Chemotherapy has been around for over 60 years now, and the types of chemotherapy drugs that we use have been very carefully studied over this time. The dose is something which we've looked at very carefully, and we've worked out the best dose which can optimally kill the cancer cells without causing too many side effects. For any new drug that we use, there's a very stringent process which we go through before introducing it to patients. First of all, we obviously need to make sure that it works on cancer cells in the test tube, and then often it will be studied in the laboratory, sometimes on animals, before being introduced to people. When a new drug is first introduced to people, it's usually given to patients who have had many relapses, who don't have any other options. And the first thing that we want to do is work out what is the optimal dose. We start very, very low and gradually move up until we get to the highest tolerated dose. From that point, we go on to do large clinical trials to work out, is this drug effective, and is it more effective than the conventional treatment for a particular type of cancer. And only once those big trials involving many hundreds, sometimes thousands of people have been carried out, does a drug get brought to the hospital. So the process from the development of a drug to getting it to a patient is something which is studied very carefully, and there's very stringent regulations around it to make sure that what we are doing is safe.